Support for this podcast comes from the law firm of Davis Malm. Whether you're a developer, property owner, manager, or commercial tenant, their real estate attorneys know the lay of the land, not just the law. Learn more at davismalm.com.
WBUR Podcasts, Boston.
I'm Daryl C. Murphy, and you're listening to The Common. Happy Labor Day, everyone. Team Common's taking the day to relax, and we hope you are too. So today, we are bringing you a story from our friends in the WBUR newsroom. This story comes from senior health reporter Priyanka Dayal McCluskey. For decades, gay men were banned from donating blood in the U.S., based on fears that these donations would spread HIV. But this year, federal officials updated the guidelines. Massachusetts Public Health Commissioner Dr. Robbie Goldstein had pushed for the change and was one of the first in Massachusetts to donate under these new guidelines. Here's Priyanka with more.
The morning after the mass shooting at a gay club in Orlando in 2016, Dr. Robbie Goldstein watched the news and cried. He wanted to do something, like donate blood, but as a gay man, he wasn't allowed.
I thought about that after the Boston Marathon bombing when I couldn't donate. I've certainly thought about it during the COVID pandemic when blood supplies have been incredibly low.
Federal guidelines put in place during the HIV epidemic in the 1980s banned men who have sex with men from giving blood. Goldstein is an infectious disease physician. He spent almost a decade pushing to lift those restrictions. He dug into data and published a scientific paper working with his longtime friend and mentor, Dr. Rochelle Walensky. She led the CDC for 2 years and brought Goldstein on as her senior advisor. Closer to the seat of power, they advocated for change.
We saw it as a policy that had a place in history, but now it just doesn't fit with the science.
Donated blood is already tested for diseases, including HIV, and in May, federal officials dropped the ban. They said blood donors should be screened based on their behavior and risk of HIV, not their sexual orientation. Walensky watched as the Red Cross updated its guidelines this month.
You do a lot of work on behalf of the American people, on behalf of the people of Massachusetts, and you don't necessarily always see it pay off with such a tangible outcome. So it was really fulfilling to see this one happen.
For Goldstein, the policy change is deeply personal.
I want to give back, and now finally I can.
Yesterday, Goldstein and Walensky met at the Red Cross Donation Center in Dedham and gave blood side by side.
I'm nervous about my iron level. I'm nervous that I didn't drink enough water, but I'm really excited to do this.
Goldstein says the new blood donation rules are rooted in evidence, but may need to change in the future as science advances.
Policy can take a long time, and that is a lesson that I learned through this. But if you continue to go back to the science and you keep pushing, things can happen.
He says the new guidelines could allow as many as 5 million more people to donate blood. For 90.9 WBUR, I'm Priyanka Dayal McCluskey.
Thanks to Priyanka for that story. And that's it for today. Thank you so much for listening to The Common. We'll be back with our regular show tomorrow. For now, I'm Daryl C. Murphy, and I'll talk to you soon.